We, the National Breast Cancer Coalition, first met Hillary Rodham Clinton in October 1992. At that meeting, a group of us explained what we wanted to do in forming this coalition. She got us, and she cared about us. She understood that we are not a timid organization and that we intended to challenge the status quo, that we are complex and often controversial. She recognized that that is the only way we will truly end breast cancer. There are very few people who are always there for you, no matter how difficult the issue. She has been. Over the past 20+ years, I have personally seen her compassion for those who are ill, those in need. We have benefited time and again by her strong and courageous leadership. From her years in the White House as First Lady, when she performed her magic and saved the DoD breast cancer research program on more than one occasion, where she helped ensure that the CDC Breast and Cervical Cancer Treatment Act became law. In the Senate, she led our charge for our breast cancer research and the environment legislation and pushed back against those in both parties who did not support it. As Secretary of State, while she was dealing with all the turmoil in the world, she did not diminish her commitment to women's issues, including breast cancer, and she worked to expand access and care globally. And at the Bill, Hillary, and Chelsea Clinton Foundation, she continues to bring her powerful voice and incredible intellect to bettering the lives of women around the world and giving women and girls a voice. And wherever her next venture takes her, I know we will be a part of it. In NBCC's world, the world of activism, there is no higher accolade than to say, she gets the right things done. That is Hillary Rodham Clinton. Whatever progress NBCC has made on our mission to end breast cancer, whatever movement there has been to better access to care and science for all women, Hillary Rodham Clinton had a hand in it. And so, on behalf of NBCC, of all of us, please join me in honoring this extraordinary individual, the Honorable Hillary Rodham Clinton.
Thank you. Thank you all. Thank you very, very much. I am a card-carrying member of the Fran Visco cult and a proud supporter of the National Breast Cancer Coalition. And I am so honored again to be with you and to thank you. Thank you for the incredible work that you have done now for more than 22 years. I want to congratulate all of the honorees. It really was so touching and emotional for me to be backstage and hearing from Jessime and Wanda and to know that they were speaking not just for themselves but for so many women here in our country and around the world. And I'm so grateful to Cindy for her leadership, her extraordinary sense of how to energize and empower women, not only on behalf of their own lives and futures, but on behalf of causes like the continuing fight against breast cancer. It has been 22 years. We've come a long way together. I know some of you were with me and Fran on that day in 1992. That was especially meaningful to me because I am of a vintage that I can remember when breast cancer was a disease that killed my mother's best friend, but people didn't talk about it. It wasn't discussed in polite company. It was like an embarrassing family secret, which made it a double tragedy. And we owe so much to women who really were pioneers, whose names we know, like Betty Ford or Happy Rockefeller, and many, many others, whose names we may not, but who rejected the stigma and opened Americans' eyes to the realities of breast cancer and inspired all of us to join together to fight breast cancer. And that's especially meaningful to me because, as Fran said, as I've traveled the world over so many years, I have seen how still today this is a disease that people don't talk about, that people are not mobilized against. So when I think back to that October 1992 meeting, it really brings a big smile to my face because there were a couple of buses of breast cancer advocates that were heading south out of Washington to come to this meeting with me. We were in the thick of the '92 presidential campaign, and there were some problems with the buses. And I hear some knowing laughter. And in fact, there were a number of true bumps in the road, and I didn't know what had happened because this was pre-cell phone. Some of you may be too young to remember. There was not always cell phones. And so we were waiting and waiting, and in comes this motley caravan of cars heading down the highway that had literally hailed help. Fran was, as I recall, in a pickup, and they were determined to get to the meeting. I was determined to wait for them to come, not knowing what they were going through was nothing compared to their courage in the face of this disease. And so they just figured out a way to hitch the rides and get there. It was a big group. We sat around a long table, and the stories just poured out. Many of the women who were there that day for that meeting knew they didn't have much longer to live. Others had, and still do, live with the disease. But each of them was committed to adding her voice to this crucial national conversation. And out of that first meeting came an enduring partnership. I told Fran that if my husband was elected president, we would meet in the White House, and we did. We met in the White House, and you all went on to create the National Action Plan on Breast Cancer, the very first time such an effort had been undertaken. It was a unique collaboration of government scientists, private industry, private citizens, and the National Breast Cancer Coalition has been the driving force to continue to push forward on the plan ever since. When I think about what this coalition has meant, it's really very inspiring to me because there are a lot of groups that are devoted to fighting against diseases, lots of different kinds of cancers, lots of different other diseases. But this coalition really brought something new to the arena where these fights take place. By advocating for and winning significant increases in federal funding for breast cancer research, and then staying involved, making your voices heard, so that the money and the commitment was not just going to be taken for granted, but that you would be there in the arena, day in and day out, making the case for what needed to be done to try to understand what causes this disease and how to prevent it and how to meet that deadline of January 2020. Fran mentioned the Department of Defense Breast Cancer Research Project. That was an idea that we came up with because we realized that no matter what would happen to the government's budget, the Defense Department would always be funded. And therefore, we made the case that the Defense Department, which has a lot of women employees, both military and civilian, and has a lot of members of families who have been affected by breast cancer, could play a real significant role in this fight. And Fran is right. Every so often, somebody would say, why is the Defense Department giving money to breast cancer research? And somebody would say, I don't know, doesn't make sense to me. We'd cut it, and then Fran would call me and say, they've done it again. They've cut the money for the Defense Department. And then I'd start making calls, and we'd get it back in. And to this day, it is still funded, and it's been a major contributor in trying to advance our understanding. But in addition to the research and the advocacy around research, I really appreciate your push for expanded access to treatment for low-income and uninsured women. That, to me, was an important addition to the coalition's agenda. And I also really appreciate the way that you've taken that concern and expanded it globally. We were talking at our table over dinner how the research about this disease is still primarily moving forward in the United States. Treatment may be looking pretty much the same in many ways as it did 22 years ago, but we are moving forward in our country compared to so many women across the world for whom there is very little hope and very little treatment. So much of what will save their lives will come from the work done here, and that is directly attributed to the work that you have done in the coalition. You know the statistics in our country, the 1 in 8 chance of developing invasive breast cancer during our lifetimes, the 40,000 women and 430 men in the United States who will die from breast cancer in 2014. In 2012, the last time I could find the statistics, 522,000 women worldwide died from breast cancer, more than 1,000 women each and every day. And we still have the disparities in treatment, even with the advances we've made in providing insurance. While white women in the United States are more likely to develop breast cancer than black women are more likely to die of it, a fact that NBCC highlighted and continues to make an issue as we look at what are unfortunately persistent inequities in our healthcare system. So we need you out there. We need you on the front lines. We need you to keep reminding everyone who can hear you that we have a deadline to end breast cancer by January 2020. You've zeroed in on 2 areas responsible for more than 90% of breast cancer deaths: primary prevention and prevention of metastasis. It's so important. You know it. You're here. But I feel like I should be passing out honors to each and every one of you, because truly I so greatly admire the consistency, the persistence of your advocacy and your action. And I hope that we will have a big celebration in January of 2020. And if we do, it will be because of your unflagging passion and commitment. That you believe, as I believe, that one day we will live in a world where breast cancer has been eradicated. The fear and the suffering is behind us. Our daughters, and in my case now, our granddaughters, will not know what breast cancer is. That's what has always driven Fran and the coalition. Always has gotten her up to fight against the odds, bringing all the rest of us with her. It's just easier to say yes the first time. And to never give up, to always stay focused on the future. So thank you. Thank you for what you have done. Thank you for the extraordinary example you have set. Thank you for the progress that we have made because of you. And thank you for being absolutely committed to finishing this fight until we win it. Thank you all very much.